What if the trauma you survived keeps you trapped, not just in memories, but in every relationship, belief, or emotion? That's life with complex PTSD, C-PTSD, a deeper, longer-lasting injury from repeated traumas or long-term abuse. But C-PTSD is not the end. With understanding and support, healing and new beginnings are possible. This video breaks down what C-PTSD is, how it's different from PTSD, signs to look for, and how you can move forward, step by step. What is complex PTSD? C-PTSD is a mental health condition that develops after prolonged, repeated trauma, like ongoing abuse, neglect, domestic violence, or being trapped in dangerous situations. It goes beyond regular PTSD, adding more severe symptoms tied to the way you see yourself, feel emotions, and relate to others. It's not an official diagnosis everywhere, but is now recognized by the World Health Organization, ICD-11, and many top trauma doctors. Causes of complex PTSD, C-PTSD often develops after long-term childhood abuse or neglect, domestic violence or repeated sexual, physical, or emotional assault, human trafficking, slavery, or imprisonment, surviving war, torture, or repeated community violence. These traumas are often inescapable and inflicted by people the victim depended on, making trust and self-worth hard to repair. Core symptoms. How does C-PTSD feel? C-PTSD includes all core PTSD symptoms: reliving trauma, flashbacks, nightmares, distressing memories, avoidance of reminders, people or feelings, sense of threat, hypervigilance, being on edge, plus additional features called disturbances in self-organization, DSO. Trouble controlling emotions, anger, sadness, fear, or shame that feels overwhelming or out of the blue. Chronic emptiness, hopelessness, or feeling permanently damaged or worthless. Intense guilt, shame, or self-blame, even for things that weren't your fault. Difficulty trusting or feeling disconnected, even with close friends or family. Major challenges maintaining relationships, sometimes seeking out unhealthy dynamics, or feeling unable to get close at all. Regular episodes of dissociation, feeling detached from your body or the world, not really here. Physical symptoms, chronic pain, headaches, stomach issues, fatigue, or health complaints without clear medical causes. With C-PTSD, you may have emotional flashbacks, sudden, intense feelings of shame, fear, or powerlessness, reacting to present events as if you're stuck in the past, often without clear visual memories. How is C-PTSD different from PTSD? PTSD can develop after any trauma, often a single event, accident, disaster, assault. C-PTSD comes from trauma that is ongoing, repeated, or inescapable, usually at a young age or by caregivers. C-PTSD symptoms hit deeper, affecting emotions, self-worth, and connections with others, lasting years or even decades if left untreated. A trained mental health professional can diagnose C-PTSD through detailed interviews and symptom tracking after ruling out other causes. Naming C-PTSD can validate experiences, open up new treatment options, and reduce self-blame. Recovery is possible, though it usually takes time and long-term support. Trauma-focused therapy. Trauma-focused CBT, EMDR, eye movement desensitization and reprocessing, and sometimes longer-term supportive therapy are the gold standard. Therapy gently works through trauma, builds emotional regulation, and repairs trust, self-worth, and relationship skills. Medications, antidepressants, mood stabilizers, or anti-anxiety drugs may be prescribed to help manage overwhelming symptoms. Group support. Peer support, group therapy, or online forums can reduce isolation and provide real understanding. Other interventions. Learning grounding skills, mindfulness, and self-care routines are essential, as is having stable, consistent support. Continued aftercare. Ongoing support after formal therapy ends is crucial for lasting healing. Practice grounding and self-soothing, cold water, deep breaths, or listing current surroundings. Keep a journal to track triggers and victories, no matter how small. Seek meaningful connections in safe, supportive spaces. Be patient with setbacks. Recovery isn't linear and every small step matters. If C-PTSD leads to thoughts of self-harm, despair, or inability to cope, seek urgent professional help. You are not alone. Help, care, and healing are always possible. Your past does not define your future. C-PTSD is proof of survival and resilience, and your healing, self-worth, and joy are still possible no matter how long the journey. Every step forward, no matter how small, is healing. Light, trust, and peace are possible, one gentle day at a time. If this video brought you hope or understanding, please like, share, and subscribe. Your story or your support might help someone reclaim their strength today.